So I think we have our first question there, if you want to.
Yeah. Can I ask?
Okay, so our first question?
Yeah. My question is to Dr. Ganga Kherkar. In one of your slides, you mentioned about patient's perspective that they do not consider Ayush medicine as toxicity. In that line, what is your experience or what is your opinion that should we consider Ayush or traditional medicine in the HIV cure?
No, when I referred to that, it was with respect to patients' belief that only Ayush drugs don't cause toxicity, rest of them are all toxic drugs. That's their perception, and that's why they worry. Do we think we can use Ayush drugs to try and see whether there could be a cure? Perhaps yes. You need to still look at it. I don't want to speak prematurely, but one of the functional cure claims appears to be strong enough. But we need more evidence prospectively.
Thank you.
Question to Dr. Ganga Kherkar. The news was in paper about Urinostat, and they claim to be cured one patient. What is your view in the future? What will happen to this drug? Will it work in the other patients or not? Any opinion?
I think it is premature today to speak on just one single case report as such. We perhaps a structured trial in itself will give more better answers to this. But it's healthy in a way that we are at least approaching the problem, and we may perhaps find answers if there are any difficulties that could be seen in such trials subsequently.
Thank you.
Jody, a comment. And this is not to defend men, but we have seen the same results also in Uganda, beside the one of the Malawi, that older men have sex with women. But that in that case is because the local belief is that having sex with the virgin would would solve some of the health problem. And actually that allowed us in 1995 to identify that clade A was not the original genotype, but was the one that actually was transmitted in the northern part of Uganda.
Thank you.
My question is to Dr. Jyoti. We in India are all awaiting dolutegravir. It's being presented as an amazing. We in India are all waiting for dolutegravir. It's being presented as an amazing drug. There are no side effects, no resistance. But you just mentioned in your talk that you do see problems. Could you just expand on that?
As regards women, I don't think it's just that there is very little data regarding its use in pregnancy.
Yes,
we mentioned, somebody talked about it yesterday as well. And so I said, yes, it's the new kid on the block, but when it comes to pregnancy, there isn't enough cases that have gone on to the APR registry that will tell me that it's safe to use in pregnancy. So, there's a bit of a caution. We know it's a very good drug. It's very effective. We have practically seen no resistance so far. Saying that, they started off saying there are no side effects with it. We are seeing side effects the more we are using it, especially insomnia is a huge problem with this drug. So I don't know how it will pan out in the Asian because every individual is different. But what I'm saying is that it's its use in pregnancy or where a woman is considering pregnancy, I tend to veer towards using the alternatives including a tripler, because there is enough data about use of a tripler, and there has been no increased signal. So I prefer to use that at this moment in time rather than dolutegravir. And I do give women the option. I say to them, you know what, if you start on this, I can always switch you once you've had the baby. You can be switched on. That's the way I deal with it.
Thank you.
And I think we have time for 2 last questions there. Thanks.
Good morning. My question to Dr. Jyoti, ma'am. Ma'am, have you observed any difference in neuropsychiatric disorder between pregnant women and non-pregnant women? Like pregnant women are having lesser neuropsychiatric complaint due to efavirenz in compared to
No, not really. No. I mean, there's not less or more or less of it in pregnancy. No.
Thank you.
To Jyoti ma'am, ma'am, in India we know about the tenofovir-based vaginal gel. I just wanted to clarify that, did you mention about the vaginal ring with NNRTI-based medicine?
Sorry, I didn't get. No.
What,
Yes. Sorry.
So the question
what's
is on the tenofovir ring?
no, so if it
Yep.
is
This is-
NNRTI-based,
This is a defervaring ring,
so,
which is an NNRTI.
so does it behave like, will it affect anywhere the function of or the resistance related issues?
No, it's being tried out at the moment, and so far it seems pretty safe.
Thanks.
Okay, so thank you to all of our speakers.
Dr. J.K. Maniar is consultant in HIV in Mumbai.